Harriet. I'm the Clinical Trials Director for the Inflammation Research Foundation. And today I'm here with Dr. Barry Sears, President and Founder of the Inflammation Research Foundation. Dr. Sears, thanks for being with me today.
Well, thank you, Mary.
So Dr. Sears, today I want to talk about our cellular inflammation test kit. But first, I think it's important for our listeners to know what we mean when we use the word inflammation. So can you walk us through what inflammation is?
Well, we need some inflammation, but when we have too much, it's the underlying cause of virtually all of our chronic disease. But there's two types of inflammation. One is the type that hurts. That's why you see a doctor. But the second type that's really the underlying cause of chronic disease is really below the perception of pain. You can't feel it, but it's grinding down each tissue in your body until you eventually develop a chronic disease.
And how do you know if you have silent inflammation? How can you test for it?
Well, you have to test the blood because you can't feel it. So therefore, the blood will give you an indication. And the best marker used in clinical research is the ratio of two fatty acids. One is called arachidonic acid, and the other is called eicosapentaenoic acid, or EPA. One is the building block of hormones that drive inflammation. The other is the building block of hormones that decrease inflammation. So you want to maintain those two in an appropriate balance.
And most people actually have really high levels of silent inflammation. So what's the best way, if your levels are high, for you to get them within the desirable range?
The best way and the easiest way is taking adequate levels of extra omega-3 fatty acids. How long will it take? About 4 weeks. That's the good news. In 4 weeks, you can basically reduce significantly the levels of silent inflammation in every organ in your body. Now, here's the bad news. They're also used as energy sources. So after 2 weeks, if you're not continuing the supplementation, the levels of silent inflammation will climb back up to their original levels.
So consistency is key. So you just said it takes about 4 weeks for the levels to change, but how often do you recommend somebody use the test?
Well, once you get down to that range we talked about between 1.5 and 3, then I'd take the test maybe once a year just to make sure that you're taking adequate levels of omega-3 fatty acids that keep the ratio in that target zone.
Now, this is a clinical test that's used a lot in clinical research, but it's not something that physicians are using routinely. So how do you think this actually would allow physicians to practice better medicine?
Well, first of all, we had to make it simpler to use. People hate to give blood, but they don't mind giving a finger stick. So we had to develop a finger stick test that makes it very simple to get enough blood to do the test. Now, what it does, we said earlier, this silent inflammation is the underlying driver of chronic disease. The sooner you recognize the body is under inflammatory attack, the sooner you can reduce it and improve dramatically the health status of your patient.
Excellent. Well, Dr. Sears, thanks so much for joining me today. It's always an enlightening experience for me. So thanks for your time.
Thank you.